I want to tell you a story about a mother. Her name is Joy, and she lives in a small village tucked away in the eastern province of Zambia. It's a country in the south-central part of sub-Saharan Africa. Joy is 18 years old, probably about the same age as many of you in the audience today. She went to school till about grade 6. She got married at the age of 15, and she had her first child at the early age of 16. Her son's name is Gabriel. He's almost 2 years old. Her husband is a farmer, and they grow maize on their family's land. This is where they live. It's a happy home. They don't have electricity, and they don't have a vehicle. So, whenever Joy needs to go somewhere, she generally walks. She walks to fetch water from a stream about an hour away on a daily basis. She walks to get firewood so that she can cook nshima, a local dish made of maize, for supper. She even walks to the local shop about 15 minutes away, where she can buy oil and biscuits and talk time for her new cell phone. Pretty cool. She could even buy a bottle of Coca-Cola if she wanted from this very same shop. But today, she has to walk to the health center, unfortunately. You see, Gabriel has fallen ill. He's been vomiting and he's had diarrhea for about 2 days. This is the third time this year that Gabriel has had diarrhea. And Joy knows that this is something that she needs to take very, very seriously. She knows that she needs to get him to the health center so that she can get him the medicines that he needs to get better. Now, I know none of us have ever probably thought about diarrhea as being a serious disease. Why would we? In Canada, in the US, in Europe, rarely would someone die from something like diarrhea. And that's largely been due to advances in water and sanitation, per capita income, antibiotics, vaccines. But as Dr. Cheng mentioned earlier, diarrhea remains the second leading cause of death in children under 5 globally. That means that in sub-Saharan Africa, out of the approximately 1 in 8 children that won't make it to their 5th birthday, 11% of them will die because of diarrhea. Just to give you a comparison, in Canada, the number of children that die before their 5th birthday is 1 in 169. A stark comparison, one that points to the inequity that exists in our world today. Now, I want you to really think about that for a second. Picture all of your friends on Facebook. Now just imagine that 1 out of every 8 of those people never made it to their 5th birthday. For Gabriel and his friends, that will be the reality. And the worst part is that over 60% of these deaths are preventable. They're preventable with existing solutions, things that we already know about. Joy, for example, we know that she's going to have to give Gabriel 2 simple medicines, oral rehydration salts and zinc, ORS and zinc. This is the globally recommended treatment for diarrhea. So, she sets off for the health center with Gabriel on her back. That's the only place that they can really go to get these medicines. But it's a very long ways away. It's 3 hours to get there. So, after hours of walking in the very hot sun, she finally gets to the health center, only to find a very long queue of mothers waiting. They've been waiting there since the morning. And with only 1 nurse working at the health center, chances are they're going to be waiting a while. And they do. After a couple of hours, they finally get to see the nurse, who informs them that unfortunately, the health center has stocked out of ORS. The delivery that they were supposed to receive a few days ago never came in. Now, this is a very common scenario. And recent evidence has shown us that on average, 1/3 of the world's population doesn't have effective access to essential modern medicines and vaccines. In sub-Saharan Africa, 47% of the population doesn't have access to these medicines when they need them. So Gabriel and Joy, they're not alone in this dilemma. It's a very common situation throughout the developing world, faced by millions of mothers and children. Now that's a problem. That's not okay. In a world where we can put robots on Mars, it strikes me as being very odd that we can't get life-saving medicines to the people that need them the most. We generally know what we need to do. Identify the existing cost-effective interventions that we know work, and figure out how to deliver them in the most effective, efficient, and equitable ways possible. Now, to address that implementation gap, we're going to need to think outside of the box. We're going to need to innovate. We're going to need to work across disciplines. We're going to need to create new partnerships, and we're going to need to revolutionize the way that we do global health. And so for the rest of the time today, and I don't have too much more time, I want to talk to you about one idea. One idea where we're attempting to do exactly that. So with my colleagues Simon and Jane Berry and a number of local partners in Zambia, what we're trying to do is get those life-saving medicines to the same place that Joy would go to buy her biscuits and talk time. Now, if you remember back, I told you that if she wanted to, she could buy a bottle of Coca-Cola from that very same shop. And that's true. In all of my travels around the world, I've never been to a place where I couldn't find a bottle of Coke. Even in the most remote, random parts of the world, you can find a bottle of Coca-Cola. Somehow it gets there. And it gets there because of demand for the product and because of the entrepreneurial drive of small, local, community-level, private sector retailers. These are the guys that go down to the district-level centers, to the wholesalers, and they buy all different kinds of products that they take back to their communities. They take it back that last mile. And they do so via bicycle and mule and bus and motorcycle, you name it. And wherever they go, so too does this empty space between the crated bottles of Coke. So we saw an opportunity there, one with the potential to address one of the major bottlenecks that we saw in the global health system. So what we did is we came up with this guy, what the BBC dubbed the Aid Pod. Get it? Instead of iPod, Aid Pod. So this is a plastic container that fits into the empty spaces between crated bottles of Coke. You could put whatever basic medicine you wanted in there, any kind of public health good that would fit, you can put that in there. But what we did in collaboration with local partners and based on local need is we developed it into an anti-diarrheal kit. We called it the TEDxYouth, which means kit of life. Now inside that kit are 4 very important items. The first is a small bar of hand soap that sits on a tray, and that tray also doubles as a lid for the container. Now, hand washing is probably one of the most important public health interventions of all time, and it's one of the most important things that people can do to prevent diarrheal disease. So what that does in there is it connects the messages of prevention and treatment. The next item is zinc, pediatric formulated, a blister pack of 10 tablets. It's sweet and it dissolves on the tongue of the child, so they're not going to kind of think it's disgusting. And the third thing is ORS. 8 sachets of each weighing just over 4 grams and making up 200 milliliters of solution. And now, the interesting thing about this is these are, to our knowledge, the first ever mini sachets of ORS ever produced in Africa. and we did so with a local manufacturing, with a local pharmaceutical company. And the container itself, it measures exactly 200 milliliters of water. So you can put one of those sachets into that container and it'll mix the solution in the perfect concentration, which actually is one of the major barriers to proper utilization of ORS. The final thing in there is an instructional pamphlet, information, education, communication material. It serves as the branding for the product. It has 2 local languages, instructions in 2 local languages and in English. And it also has a bunch of pictures for the approximately 25% of the adult population in those areas that can't read. So now, because of shopkeepers like this, whose shelves are always full of products, and instead of having to travel for hours and hours and hours to get to a health center, mothers like Joy can go to their local store and they can find these kits on the shelf. So now with training of retailers, with radio spots, and with community events like this, drama, where promoters are educating communities about the kits, we hope to raise awareness of the prevention and treatment aspects of diarrhea. And we hope to allow mothers to know that there's this new, more accessible option that where they can go and access these life-saving medicines. All of this to say that children like Gabriel have the right, and we have to facilitate that right so that they can live a happy and healthy life. Thank you.